Hello everyone, my name is Pablo Cortez and I'm a physical therapist. The topic about today is about our case discussion, and I prepare for you some slides pointing some the main aspects that I found important. So I will share here with you just a minute. Okay. So the title is Randomization, the Dilemma of Simplicity versus Imbalances in Small Studies. The question that I put here was, who is Professor Luigi Lombardi? And he is clinical pulmonary physician, chief of pulmonary physiology department, and associated professor. He actually is working in the large Policlinico Universitario, that is a hospital in Rome, and he's developing a new drug, a new pharmacological drug intervention, especially for asthma and exercise-induced asthma. That is a special condition, okay? So the name of the drug that he is working is QVU 0024, and he already saw that preclinical and phase 1 have shown some safety regard the subjects and preclinical. And about this moment, he's finishing his grant proposal to get some funds to his clinical trial. However, he is at the moment concerned about the randomization process that he must choose, because his previous experiences relate to that were not so good. So he's conducting at the moment, he's planning to conduct at the moment a phase 2 trial that we're going to have two arms. One is going to receive the standard care plus placebo, and other standard care plus the new drug, the QBU. He he made a sample size calculation, and he estimates that he can recruit 6 subjects for the research. Okay. One thing that is very important here is that he has limited funds to do this research. Okay. So the challenges, the concerns, it's all about the balance between allocation consumption, sample size, small sample size, that is 60 subjects, limited funds, the covariates that he thinks that is very important to consider for his study. He's trying to deal with the best strategy to choose the randomization, and he's trying to see what is the best and how each method could offer a risk of imbalance the groups. Okay, so he's trying to choose about simple randomization, blocked randomization, could be fixed, blocked randomization, random block randomization, stratified randomization, and he also thinks about adaptive randomization, minimization, and adaptive response. Okay, that is his choice at the moment. And I prepare for you the pros and cons of each one of them. So the simple randomization, for his case, the pros are he has 50-50 equal chance. The subjects are going to the groups, right? So it's simple, it's limited budget, it's feasible, but we have the cons that are imbalanced groups, could lead to imbalanced groups, covariated, there's no consideration for it. So, but I think that what Professor Luigi left so clear in the case discussion is about the covariates. So I don't think that simple randomization could be a choice for him. Okay, so blocked randomization, fixed. the pros and cons. The pros, it's that we could have balanced groups unless the study is interrupted, right? However, we have the cons that we can deal with covariates. We can't deal with the covariates, and the investigators can deduce the allocation process, right? So one way to deal with it will be the blocked randomization by the random form. So here we have the pros and the cons. The pros could be balanced groups unless the study is interrupted, and here we have also the cons, covariates, and the risk investigators can deduce the allocation is decreased. So I don't think blocked randomization could be a choice for him. However, there are some aspects that we must consider to choose the best method, okay? So we have the stratified randomization, and the pros are the covariates that he wants so much, and he's going to separate in stratas. It's easily accepted for the other physicians. The cons is that could lead to imbalances between the groups, but attends his purpose, right? So he initially wants to deal with 4 levels, that is high physical activity and severity disease, high physical activity and moderate and mild, I don't know, the disease, low physical activity and severe disease, and low physical activity and moderate or mild, I don't remember the pronunciation. And here, when we talk about stratified randomization, it could be conducted by 2 forms, simple randomization or blocked randomization. Simple randomization could lead to imbalances between the groups, and blocked randomization could lead to more balance, right? But he also is considering increase for 8 levels, right? But he stop and think that could be failed, right? There are so many stratas to divide the subjects that are going to get in and to do into the study, okay? So it is a good option for me. I think that could be, at the moment, could be. But looking at this, the adaptive randomization, that is randomization and adaptive response, here in the first block, we see the pros and cons of minimization. The second block is the pros and cons of adaptive response, okay? So the pros of minimization is a large number of stratas in small studies, that is what Professor Luigi is handling at the moment. And the cons are the complicated, they are difficult to conduct an analysis. The statistics is very difficult to interpret. So the pros of adaptive response is that randomization occurs according to the response of previous participants. I think this topic is going to be more detailed discussed in other topic about this week. And the cons is choosing the statistical analysis and could lead to other bias also, right? The cons are choosing the statistical analysis and other bias. I think, in my opinion, that this is the best option for Professor Luigi. However, we need to consider that he doesn't have too much funds to conduct the trial, right? Here in adaptive randomization, we have costs. because we have the statisticals, we must have the program that will process an algorithm. So it will be more expensive, but I think that could be the best choice. However, if the funds are some very critical for him and he can choose the adaptive randomization, a second option more suitable will be the stratified randomization. And considering considering having 4 levels, okay? Only 4 levels, not 8 levels. This is my opinion. And here I took the flow chart we have in Professor Felipe book, and that is the sample size small? Yes, in this case, yes. So we can exclude simple randomization. Are there important baseline covariates for this case? Yes, there is. So we can use blocked randomization. More than 2 or 3 covariates? In my opinion, yes. So I choose the adaptive randomization. However, as I already told you, if the funds are something very limited for him and his staffs, I think that he should opt for stratified randomization. But my option in the poll votation in the Google Classroom will be to adaptive randomization. Okay, so this is my option here, and I think I will share with you here the slides. If you didn't understand anything or want to comment something, please let me know, and thank you very much. Okay,